Hello, my name is David Nobles, and I will be covering Japan's healthcare system. So, how come Japanese people have the world's longest life expectancy? Well, it's a range of factors actually, including their healthy diet, but the country's impressive healthcare system is also another key reason. Coverage. Japan has universal public healthcare. It's a legal requirement for all Japanese citizens to have the health insurance provided by the state. The coverage is quite thorough and entitles people to choose their own clinics and hospitals from any of the vast majority that are part of the system. Social health insurance is the public healthcare system for everyone who is employed full time by a medium to large company. Social health insurance also provides benefits for the high medical costs of surgery and hospitalization, birth allowances, and some costs of care overseas under some circumstances. While a few subtly different types exist depending on the type of job you have, it offers much the same benefits across the board. You and your employer contribute equally to social health insurance, each paying around 5% of your salary. National health insurance is pretty much for everyone else. Students, freelancers, people who work for small companies, for example. Your contribution is based on your yearly income and might cost you a little more than SHI would, although the first year is often very cheap. You have to sign up for it yourself at your local office that's run by the regional administration. National health insurance also provides benefits for high medical costs associated with surgery and hospitalization. Quality. Unlike in many countries, there's no system of general practitioners in Japan. Instead, people head straight to a specialist operating at a clinic. There are many different specialists available in Japan, where it operates under a hybrid system. The government pays 70% of the cost of all health procedures, unless you're low income or elderly resident, in which case it pays as much as 90% of the cost. The remaining 30% is covered by private health insurance, either employer sponsored or privately purchased. Like NHI under like national health insurance under social health insurance, patients are required to pay 30% of the total cost of care at clinics and hospitals. Spending on private health insurance to cover the 30% copay is partially tax deductible. Benefits are the same for everyone, and unlike many US health plans, include dental and mental health care. For catastrophic care, poor people and people with disabilities or certain chronic conditions, the government contributes more. Our nation has achieved an average life expectancy of and healthcare standards that are at the world's top levels. The Health Ministry declares on its website, citing four main features of the system: insurance for everyone, regardless of pre existing conditions and economic status; free access, meaning patients are free to choose any hospital nationwide; high level care at low cost, and the use of public money to maintain it. Cost. Average cost of public health insurance for one person is around 5% of your salary. Healthcare isn't free, but it's relatively inexpensive. In addition to having to pay monthly premiums into the public health insurance system, Japanese citizens pay 30% of their medical bills themselves, bills that are closely regulated by the state so that they never become unaffordable. The website Japan Healthcare Info has some advice on average costs. You might be looking at around 10,000 yen to 15,000 yen at the emergency room, or 5,000 to 10,000 yen at the clinic, although it really depends on the treatment you need, so it's kind of hard to predict. And for reference, 10,000 yen is around $91.62 in US currency. Because the public system is both compulsory and quite thorough, private health insurance isn't as all encompassing as it is in some countries. However, policies are available to supplement public insurance via money towards the 30% of bills you have to pay and lump sums in the event of serious medical need. Social health insurance is low maintenance for you as it's administered through your work, and national health insurance requires you to sign up at your local office once you have your residence card, which can take a few months. Because NHI is run by local authorities, you'll have to do this again if you move to another area. And once you're registered, you'll get sent a medical card. And these are my references, and thank you for listening to my presentation.